After we have done the treatment, manipulated or stabilized the sacroiliac joint, if we had manipulated the sacroiliac joint in a nutated direction, was helpful, we want to give a home exercise program to the patient. If we had manipulated counter-nutation, we want to give a home exercise program in counter-nutation if it was beneficial to the patient. So let's start with counter-nutation, technique that we use most often. If you remember, for counter-nutation, the base of the sacrum will be moving posteriorly in relationship to the innominate bone. So I'm going to show a treatment for the right sacroiliac joint. We're going to ask the patient to lean back. And again, if you look at the sacrum, to help with that posterior migration of the base of the sacrum on the right side, I'm going to induce a right rotation. So I ask the patient just to put the arm behind the chair. And then, since it's a posterior movement of the sacrum in relationship to the innominate, I want that innominate to go more in an anterior direction. To help that anterior movement of the innominate, I'm going to produce with the right leg an internal rotation, so crossing the left leg on top of the right leg. Kind of like this. So internal rotation and extension, and here slouch and right rotation. Patient will be instructed to hold this position for several minutes at home, a few times a day, a couple of times a day. For the nutation home exercise program, again looking at the right side. For nutation, the base of the sacrum move anteriorly and the innominate posteriorly. If the patient likes or is more comfortable in a lordosis, you may want to put a pillow in the lower part of the lower back. If you scoot a little bit to posteriorly, right here. If they're comfortable with lordosis, then to induce on the right side a nutation, I'm going to ask the subject to rotate to the left. So we ask in this position the patient just to rotate to the left, and to induce a posterior rotation of the innominate on the right side, I'll ask the patient to flex the leg and externally rotate the hip. Then if the patient is more comfortable in a flex position and not comfortable with lordosis, you can ask the same technique, the same position. We're going to ask the patient just to rotate to the left and flex the trunk forward. So you can lean kind of on the leg like this, resting and holding this position for a few minutes at the house, repeating a couple of times a day.